So when we talk about genitourinary syndrome menopause, we're talking about, of course, vaginal dryness, painful sex, but those recurrent UTIs and that prevention of UTIs that can prevent really some increased morbidity and mortality in patients. When I try to tell a patient that using local estrogen or DHEA to the vaginal tissue is life-saving, it's really hard to tell them that. And then they look at a box warning that says they could die from this. And so for me, I feel like this, instead of having to say like, you're going to get some people really read the, inserts, just throw the insert away. So like I'm telling her not to trust what the pharmaceutical company is saying. And so now at least we're aligned with what is happening because it gets very confusing to tell a patient, well, that was based on a study for systemic therapies and, your levels, even though, you can get a little bump initially over time, we don't see an increase in systemic levels of estrogen. It's hard for like the average person to really understand. And so now that the box warning is not going to be in their face, that they have to really read the nuances of what the FDA is saying, it's going to make it a lot easier. I think the studies are showing 30% of women will not take the medication even though it's prescribed to them. So hopefully we're eliminating that.